Great. Good afternoon, everybody. I'll just give you another 20 or 30 seconds just to take a seat and get yourself ready for this afternoon's session. So welcome back after lunch. Excellent. Right, so I think let's kick off. So welcome everybody to this session. I think we've got a great hour for you. Just by way of introduction, I'm Dr. Robin Clark, so I'm the medical director for Bupa. So I cover our UK insurance business as well as our Bupa Global International PMI business. So I'm a general practitioner by background, and it's my absolute pleasure to be chairing this session this afternoon. So the session that we've got for you now is all about data-driven leadership. So this is really how we use that data, how we get the insights, and how we advance quality and safety. So this is about how the use of data and things like artificial intelligence are really going to transform and how it can transform the quality and safety of healthcare. So the sorts of things that you're going to be hearing about from our panel here, examples of how clinical models driven by data are improving patient outcomes. We're going to hear about a national program to assess quality across different healthcare providers, how the use and integration of predictive and generative AI models is leading to some quite significant benefits. We're going to hear about a technology platform for improving pediatric care through the data insights that delivers, and then how all that's wrapped together through leadership and governance strategies to really make it impactful. So that's really what you can hear from our speakers. We've got four really great speakers. We've got Mr. Atif Al-Braki, Chief Digital and AI Officer from Dubai Health, UAE. We've got Dr. Neelam Dhingra, VP and Global Chief Patient Safety Officer from the Joint Commission International in Switzerland. Dr. Thilo Gruning, Head of Division from the Division for Quality of Healthcare and Mental Health from the German Hospital Federation. And we've got Barbara Ures, President and CEO of Gillette Children's from the USA. So thank you very much to my panel. So a little bit of housekeeping just before we start. So phones on silent, please. Each speaker is going to come up and present for about 10 minutes. So if you can think of your questions while they're speaking, but do hold on until the end. So I'll let all the speakers speak, and then we'll do questions and answers at the end. If anybody needs translation, there's QR codes at the back. If you are going to use the translation service, please do use earphones just so you don't disrupt others. And if you want to know more about our speakers, there's obviously the app where you can look up the profiles. So without further ado, if I can ask Mr. Atif Al-Braki, Chief Digital and AI Officer, to take the microphone, please. Thank you.
Thank you, Robin. I think I need to use the...
You need the clicker. Yeah. Indeed you do.
Great. Thank you. Good afternoon, everyone. My name is Atif Al-Braki. I'm the Chief Digital and AI Officer of Dubai Health. And maybe just a quick background about Dubai Health. We are the publicly funded health system in Dubai. Dubai is the second biggest state in United Arab Emirates. The population is around 4 million, and the size is around 4,000 square meters. We're a network of 6 hospitals, 26 ambulatory centers, 21 prevention screening centers. We also have a university with different research centers and a philanthropic organization, all fully integrated over the last 3 years under one corporate governance and a major transformation that was happening in Dubai. Prior to that, we were all under one entity called Dubai Health Authority. Today, we segregated regulation from operating the publicly funded health system. So I'm from the operator side. If you look at the history of digitization, because again, I can argue that digitization really maximized the amount of data that we have today within our health systems. Over the last 15 years, we started with digitizing our enterprise imaging, then we digitized our lab information system, then the government changed the way that we do the health system financing with introduction of mandatory insurance. So we had to digitize also our claims and the claim submission. We then rolled out our electronic medical record across all our publicly funded healthcare facilities. We rolled out Epic across all our facilities. And then we connected with the private sector through a health information exchange. And all that led to really huge amount of data within our health system as Dubai Health, but also across the healthcare sector in Dubai. And that increased the pressure of how do we make better decisions that are informed by data. Suddenly, we can see people dragging different reports. And although we have the same concept, something as simple as visit, when you speak to 3 or 4 people, everyone is going to give you a different answer. And for that, you know, when we were doing the transformation of the organization, data was defined as one of the key strategic programs of the organization. This is our 5-year strategic program, and among the 6 programs that we have at the bottom, data strategy was identified as one of the key priorities for the organization. Post that, we cascaded that as part of our digital strategy, and it's one of our 5 digital strategic goals of the organization to enable the organization to be a data-informed organization for decision-making and also using data for discovery and research. And based on that, we had to put a 3-year strategic program. And the first program that we focused on was on revamping and establishing a new data governance within the organization. And that's the key of our transformation. And this is what we started to do in 2024. We had to do a complete assessment of how do we use the data that we have across different systems, how do we make decisions today, and how, you know, what are the challenges that we need to tackle. We also did a quick benchmark to see how should we operate differently and maximizing and unlock the value of the data. And we did a co-designing workshop with different stakeholders, from clinical team, from our research and discovery team. And one of the key insights, at least from me as Chief Digital Officer, was the ownership of the data. Everyone was, the first question when we asked them, who owns the data? And many people said, well, the IT or the digital team owns the data. And we had to shift the mindset to make sure that the business owns the data. I'm struggling with the clicker. So we co-designed with them to put a data governance framework, and I'm not going to go through all the components of the framework, but if you look at your left, at the governance part, data ownership was the first thing that we had to tackle. And for that, we defined different personas within the organization. We defined the responsibility of the Chief Clinical Officer and all the clinicians under him, and the different roles within the organization, the Chief Academic Officer, and the different, what I'm going to refer to as business stakeholders, who own the data and who has the responsibility of defining the data correctly. And then we had different data stewards across the different departments who had to articulate it in a more clear way of how do we define the data, and different champions within the organization. We had to look at the operating model differently. So we went with an approach of putting a hub team within the organization who are going to be championing our data governance and our data transformation program. And then we had a SPOC team across the different missions of the organization. We had to look at the different governance committees that we had and who has the responsibility of approving the governance model, the policies, re-looking at all the KPIs that we have within the organization. And we started piloting the new governance model this year. First, we started activating with what we call few subdomains within the organization. So we went to key pilot departments, and we asked them, okay, we need to now articulate and start defining owners, stewards. We had a very specific way of how do we define KPIs. Second thing that we had to do was to unlock and maximize the different data models that we had within our EHR system. And up until recently, we activated 65 data models that were existing today in Epic. We encourage the different business stakeholders to utilize them, and we're monitoring the utilization on a monthly basis. We made sure that people are trained on the different tools that they can use, but those were just for the departments that we started piloting on. And at the same time, we standardized what we refer to as our Tier 1 KPIs. So what are the key KPIs across the organization that we need to start monitoring, and to make sure that we standardize the definition. But we did not do a major change management campaign at this stage. That's part of our next step, which is this next year we're planning to implement an advanced data analytics platform that will be enabling us to bring data from different systems that we have within the healthcare system. We're going to be focusing on 200 KPIs and to start working on building our own predictive models. We do have today predictive models as products that we buy from our electronic health record system or different software companies, but we want to start elevating the maturity of the organization to start building our own predictive models. And Q1 next year, we're planning to do a major change management program across the organization to fully activate the new governance model, define the different owners, the different stewards, encouraging all the business stakeholders to change the approach of the way that they utilize data to make a better decision making, and also to build a trusted research environment where we can de-identify the data and make it available for secondary use within the organization. So that's our data journey, started from 2024, piloting in 2025, and hope, going forward, we're planning to do the major change management across the organization in 2026. Thank you, and I'll be open to any question at the end of the sessions.
That was excellent. Thank you very much. I think that was a great way to sort of talk us through that story of how you understood what the problem was, put some structure around it, and then it sounds like you're in a really sort of productive place now in terms of moving forward and getting those insights from it. So thank you for that. So everyone, get your questions at the ready, write them down. We'll do them at the end of all the presentations. So thank you very much, Atif. Moving on to Dr. Neelam Dhingra, VP and Global Chief Patient Safety Officer. Thank you very much.
Hello, good afternoon. I'm delighted to be here. My name is Neelam Dhingra, and as our chair introduced me, thank you very much. I'm the Vice President and Global Chief Patient Safety Officer for Joint Commission International. I joined JCI 1.5 years ago, and I'm very proud to take forward the global vision on patient safety, which we created at WHO. I served WHO headquarters for 25 years as a head of patient safety and blood safety program. And what I'm going to share with you is a journey of how we've, in WHO and through JCI, we've created leadership engagement, which has really paved a path for improvement, excellence, and impact in patient safety. So if you look at the global patient safety leadership, over the last decade, there have been several leaders who have really shaped and provided the strategic direction to patient safety globally. And I cannot name all of them, but I want to really highlight the key roles some of the very eminent global influencers in patient safety have really paved the path for patient safety globally. And I would like to share with you Mr. Jeremy Hunt and Mr. Harnan Grohe in their roles as Ministers of Health of the United Kingdom and Germany. Both of them together initiated a remarkable series of annual global ministerial summits, which really paved the way for the new patient safety rebirth and led to a resolution on global action on patient safety in 2019, led to the establishment of World Patient Safety Day, and also creation of the WHO Global Patient Safety Action Plan for 10 years, 2021 to 2030, to name a few. And that was fully supported and also co-led by WHO. And Dr. Tedros, WHO DG, played a key role, and working together with Dr. Tedros, we also launched a new initiative to respond to the global call for action, which is the Decade of Patient Safety. And that was to support the implementation of the Global Patient Safety Action Plan through all the, working with partners and countries around the world. And then Sir Liam Donaldson, in his role as a WHO envoy for patient safety, I worked very closely with him and with his advice and strategic guidance on patient safety to WHO. We really were able to create a movement, a global movement for patient safety. And in my last 1.5 years journey of patient safety, I'm very proud to mention Dr. Jonathan Perlin as the President and CEO of Joint Commission International. And it's his vision, he created a vision that all people always experience the safest, highest quality, and best valued care in all settings across the world. And that vision has now really come to fruition through a global program, which is a JCI Patient Safety Pathways. So what I show you here is a new initiative which was launched by JCI. In this year, in April, 30th April actually, we launched this. It's just 6 months rollout for this program, which is the Pathways Initiative, primarily designed to build capacity and capabilities of healthcare organizations in low middle income countries in the government sector. And very specifically, we actually worked for a couple of months to design it in such a way that it incorporates sustainability, scalability, and equity principles as foundational stones of this initiative. So there are three core strategies in the initial phase which we utilized to implement Pathways, which was to increase global awareness on patient safety. So we brought thought leaders and organized patient safety grand rounds, which were on topics of critical importance and really generated significant awareness on the need for patient safety. The other approach is which we're reaching out to a large number of countries through the breadth approach of training of trainers program. And this program actually is to develop a cadre of trainers who are equipped with knowledge and skills and tools to provide training on patient safety and safe practices. And then the other final approach which we used in initial phase was needs assessment and technical support, which is the depth approach where we reached out to countries, worked with them, identified priority countries who were really committed, also identified organizations in these countries, and then are working with them to provide customized, tailored support, which is based on their real needs in patient safety. So for the Training of Trainers program, which was actually launched on the 30th of June, so we had 3 cohorts, and in July, August, and October, we invited 15 countries, and each country nominated 6 participants. These were from the Ministries of Health and from healthcare organizations. So we covered 45 organizations from these 15 countries, and we trained 3 cohorts. And overall, 90 participants have been trained so far in the last so many months, since the time it was launched in July. And 75 patient safety improvement projects are ongoing, which is remarkable because that has been possible. That has been possible only through the engagement of leaders in these countries. And I think just to also share with you about the program, it's a 6 months program, which is, it has 1 month of interactive training and a 4-month of patient safety improvement project, 5 months of improvement project, which these participants start working on actually from the beginning, but they implement in the 5 months remaining. So altogether 6 months with 1 month interactive training. And you can see the cohort and the number of names of countries, and each cohort had 5 countries. And as you can see that these were low middle income countries who are committed to patient safety and also nominated organizations to work and train their staff as trainers. For the needs assessment technical support, we then worked very closely with 3 countries, Cambodia, Maldives, and Philippines, and the governments and the ministries of health nominated altogether 8 healthcare organizations and hospitals who are now in the journey for Pathways. So you can see the names of these organizations and the hospitals which have been involved in this initiative. And just in the month of September and October, all these 8 healthcare organizations went through a very structured assessment of their needs using a new tool which JCI has developed for patient safety assessment. And this tool is based on the WHO Global Patient Safety Action Plan and JCI standards. So it's truly aligned with the global needs and priorities. So very importantly for this presentation, what were the mechanisms we used to engage leadership through the JCI Pathways for this initiative? Firstly, we provided high-level advocacy and we met with the ministries of health, the officials and healthcare leaders to make them aware of the need for patient safety. And there was actually already some level of commitment, but it really gelled very well, and this was a synergy which brought the countries together with JCI. And then we engaged with the ministries of health for nominating healthcare organizations so that we can provide them training and also go through the structured assessment of healthcare organizations. And these were all from the public sector, the government hospitals. We then engaged with ministries of health and healthcare organizations for nominating healthcare professionals for the Training of Trainers program for future trainers. We formalized the collaboration. This is an extremely important step because we wanted to have the leaders fully committed to support these initiatives. So we had formal collaborations through letters of agreement or MOUs, and these MOUs were with individuals, with the leaders of healthcare organizations, and also with the ministries of health. And JCI committed engagement through the recruitment of JCI fellows, presidential fellows in the 3 priority countries, and you can see them here who are really our foot on the ground to support and work with the ministries of health and these organizations closely. Then we also engage with partners at international level and also at national level, working with the ministries of health and the healthcare organizations. And now we have monthly coordination meetings with ministries of health and healthcare leadership. So these were a couple of very effective strategies which we used for engaging leaders and which is now showing results. So what does an engaged leader do? An engaged leader sets the vision and priorities. So the senior leaders will prioritize patient safety as a core strategic goal, and also they emphasize that safety comes first. And when the leaders say safety comes first, then their policies and goals and all the resources are aligned with that vision. And also safety goals are then integrated into mission statements, in budgets, as well as performance metrics. So just to share the example of Maldives, where the presidential office is also fully engaged, and the government of the Republic of Maldives has pledged to ensure quality and safety in healthcare delivery through infrastructure, to capacity building, and through dedicated budget allocation, as well as we have signed MOUs with all the partners, the 3 healthcare organizations in Maldives and the Ministry of Health. The government of Cambodia also is very, very committed. They articulated a clear, unwavering vision that patient safety is non-negotiable. They embedded patient safety into structures, in policies, and also communication channels, declared patient safety as a national priority, and also they expanded the scope of already existing committees to include patient safety explicitly. And I must say that JCI has been a catalyst and facilitator in bringing these countries together and these organizations together, which started as demonstration sites, but have had really a national impact. Then an engaged leader also creates a culture of safety. So they actually empower the middle level managers and supervisors so that they can translate the high-level policies into action, into day-to-day practice. They create a non-punitive and open culture and environment so that staff is encouraged to report if there's any safety incident so that we can learn from mistakes. And leaders who model transparency and empathy actually promote psychological safety as well, and they build culture to provide psychological safety to health workers and also improve the performance and care effectiveness. Another example of sharing with you about the culture. So when JCI Pathways was launched in August this year in Philippines, the 2 centers which were nominated as demonstration sites, their leaders give full commitment to build safety culture as well as provide full commitment to implementation of the Pathways initiative in these hospitals. Similarly, leadership is driving safety culture in Cambodia as well, with strong support to hospital teams, endorsing their participation and giving them protected time so that the nominated participant could participate in the TOT, and also active engagement by the leaders of the 3 hospitals, and prioritize patient safety across facilities, as well as Ministry of Health gave a very strong commitment to a Pathways initiative. So literally leadership engagement is driving safety culture in the countries, particularly Cambodia in this case. Then engaged leader also strengthens accountability as well as governance mechanisms and fosters collaboration. Very importantly, leadership at all levels is extremely important so that we establish and maintain accountability structures, as well as create mechanisms for regular monitoring of safety indicators, create mechanisms for ongoing reviews and feedback so that we trend the progress, how we are progressing. Then an engaged leader also fosters meaningful collaboration. So they reached out to partners, key stakeholders, as well as for joint action and synergy, and also created mechanism for patient and family engagement and empowerment. So again, example from Maldives, where different offices at the highest level are involved in Pathways initiative. There are mechanisms between the Presidential Office and the Ministry of Health. And now Ministry of Health is doing national coordination for all the efforts. In addition, there's a National Patient Safety Infection Control Committee, and the hospital CEOs across the entire country, not only the 3 designated sites, have actually asked for hospitals to designate patient safety champions, which is a remarkable development. In addition, if you see here in Cambodia, the Ministry of Health has given full endorsement, and the ministers actually has a leadership dialogue with more than 3,000 healthcare leaders every month, and patient safety is now on the agenda of those sessions. The Secretary of State has, providing active championship, and World Patient Safety Day, which was not observed in the country earlier. The 3 sites which we designated in Cambodia, all of them observe World Patient Safety Day this year for the first time, and now this is a national event, has been institutionalized nationally. The 3 hospital directors committed despite resource constraints, and hospital budgets now have reallocated to support patient safety. Now, an engaged leader also ensures resource allocation by providing financial, technical, as well as human resource so that we can implement safety interventions, and also helps to remove any obstacles and barriers so that we can implement and take patient safety action. So in many countries, through the TOT program, as well as through the Need Assessment Technical Support Program, there have been several the visible leadership engagement has led to allocation of resources and operational support, like materials were procured for projects in Maldives, and for Vietnam, they have a national online adverse event reporting system which has been created and integrated into existing Ministries of Health initiatives, and several other support through SOP approvals and staffing, and also support for workshops and data collection and digitalization in Bangladesh, for example. So leadership support and engagement removed obstacles and enabled cross-departmental collaboration in many of these countries. Now, an engaged leader also builds capacity and empowers team. So leaders promote that ongoing training and professional development to enhance patient safety skills of their staff, and they empower their frontline team so that they can implement and they can innovate, they can recognize risks, as well as lead safety initiative and have ownership. And they also distribute leadership so that it's not concentrated, and there's sustainability with distributed leadership as well. So in Maldives, a national level event was organized, and a national TOT has been launched following the TOT program they participated in with JCI, and the First Lady herself launched it on the 17th of September, World Patient Safety Day this year. And the formal announcements also was done for the 3 sites at this time. And finally, I would say an engaged leader also connects strategy to the front line, because active leadership involvement translates high-level strategies into practical frontline actions, and also connects the management decisions to frontline realities, so that we can reduce the gaps and enhance operational alignment as well. So sharing with you some other examples from Philippines, where these 2 designated demonstration sites have actually committed to implement JCI patient safety pathways. And these are some of the pictures of the assessment which was going on, which was supported